January is a really important month, not just because it's the start of a new year, but because it's Cervical Cancer Awareness Month. This is a topic that hits close to home for so many of us, and I want to take some time today to talk about it openly and honestly. Let's break down what cervical cancer is, why it's so crucial to be aware, and most importantly, what we can all do to protect ourselves and the people we love. It might sound a bit intimidating, but I promise, knowledge is power, and today we're going to empower ourselves together. So, what exactly is cervical cancer? Simply put, it's a cancer that starts in the cervix, which is the lower part of the uterus that opens into the vagina. The main cause of most cervical cancers is a very common virus called the human papillomavirus, or HPV. Now, hearing the word virus can be scary. But here's the key thing to remember. HPV is incredibly common. In fact, most sexually active people will get it at some point in their lives, and often their bodies clear the infection on their own without any issues. However, for some, certain high-risk types of HPV can persist and cause changes in the cervical cells, which over many years can develop into cancer. The good news, and it is really good news, is that cervical cancer is one of the most preventable and treatable cancers out there. We have amazing tools at our disposal, and that's what this Awareness Month is all about, making sure everyone knows about them. The two biggest game changers in the fight against cervical cancer are vaccination and regular screening. Let's start with the HPV vaccine. This vaccine is a true lifesaver. It works by protecting you against the specific types of HPV that cause most cervical cancers. It's recommended for preteens, both boys and girls, usually around ages 11 or 12, but it can be given to young adults as well. Getting vaccinated is one of the most effective steps you can take to prevent this disease from ever starting. Now, let's talk about screening. This is where regular checkups with your doctor come in. The two main tests are the Pap test, also called a Pap smear, and the HPV test. A Pap test looks for any abnormal or precancerous cells on the cervix. An HPV test specifically looks for the presence of the virus itself. Your doctor can help you figure out which test is right for you and how often you should get screened based on your age and health history. These tests are so important because they can find problems early, often long before they ever become cancer. And when you find these changes early, they can be treated very easily and effectively. It's a simple appointment that can literally save your life. I know that for some people, the idea of these tests can bring up feelings of anxiety or embarrassment. That is completely normal and valid. But please, don't let those feelings stop you from taking care of your health. Find a healthcare provider you trust, someone you can talk to openly about your concerns. Remember, they are professionals who do these tests every single day. Your health and well-being are their top priority. If you're feeling overwhelmed, maybe bring a friend or family member with you for support. You are not alone in this. Another thing to remember is that there often aren't any symptoms in the early stages of cervical cancer, which is why screening is so vital. We can't wait to feel sick. We have to be proactive. So this January, let's make a commitment to ourselves. If you're due for a screening, make that appointment. If you have kids in the right age range, talk to their doctor about the HPV vaccine. And let's all promise to talk more openly about this. Share this video, talk to your friends, your sisters, your mothers, your daughters. The more we normalize these conversations, the more lives we can save. Knowledge and action are our best defense. Let's make this Cervical Cancer Awareness Month count. Thanks for watching, and please take care of yourselves.